Welcome back. The counties are in the spotlight once again and their response to COVID-19. Tonight, another county, that is Meru County, shuts down for about 2 weeks or so as COVID-19 continues to infect Kenyans and affect the nation. Now, did the counties underestimate the impact of COVID-19, and are Kenyans now paying that price? That's the conversation we want to have at this time. We still have here with us in studio the Governor of Nakuru County, Kenyan. Many thanks for staying here with us. And joining us remotely is Dr. James Nikal, Member of Parliament for Seme, and also a former Director of Medical Services at the Ministry of Health. But Governor, let me begin with you and just pick up where we left off. You gave us quite a, I must say, a rosy picture of your preparations and how the county has responded to the challenge of COVID-19, both Nakuru CBD, Naivasha, so much more. But one of the challenges that counties are facing at this time is that the Ministry of Health recently went around the country assessing county preparedness, and their ranking was that only 30% of counties properly utilized funds and resources to prepare the counties for COVID-19. Why do you think the numbers were so low, Governor?
Well, I think I probably haven't seen the report, but I must say that maybe I can only speak for Nakuru and confirm indeed that we have used it as instructed, because the instructions on how the money would be used was very specific. And I must say that also this money was very important because it is supposed to help us enhance our preparedness, especially noting that the second wave has turned out to be even greater than the previous wave. So I think that's a conversation, but I cannot be able to comment on others having not seen the report. Okay,
fair enough. Let's focus on Nakuru County for a little bit. A bit earlier on, you spoke of almost 400 beds in your county to be able to handle COVID-19, and yet some residents of your county wanted to know where exactly are these beds. So I can give you a chance. You don't have to go into exact details, but just roughly tell us where are some of these beds that would add up to 400 that you spoke of a bit earlier on in this interview.
Thank you. So we first of all have beds within the private hospitals. The total is 61. And those under our hospitals are a total of 458. They are found in our Langa dispensary, they are found in Bondeni, they are found in our PGH isolation center, they are found in Subukia and Molo. All our level 4 hospitals have also been equipped to ensure that they can be able to deal with these COVID-19. We also have 40 ventilators, 19 ICU beds, and you've already piped oxygen in PGH, Annex, Langa, and Bondeni, and also in Naivasha. And like you mentioned, oxygen is the biggest commodity here that can really determine life and otherwise. Therefore, for Nakuru, we also have an oxygen plant. So whenever we run out of oxygen, we are able to get it from Nakuru, and we do not fall short of oxygen. So I would say, are there challenges? Yeah, but I think the thing is we solve them as they come, but we are up to the task as of now.
Tell me this briefly. Did the counties underestimate COVID-19? Was there a sense in which the first wave has passed, or the virus was not as did not have the kind of impact that had initially been predicted as per forecasting by the Ministry of Health? And thus, is it possible that some counties let down their guard, or the whole nation?
I think it is true to confirm that the initial entry of the pandemic, everybody was scared, including government, including everybody across all. But I think over time, people have loosened their guard, and that has also resulted in the public also borrowing a leaf. I must say also other incidents that have come in between have also undermined our war on COVID-19, especially the public awareness. And I think this second wave has also found a lot of skeptics, some who probably think it is not there. But I think the important thing as of now, unlike in the first wave where people heard of deaths from far and wide and people they didn't know, if I may speak from Nakuru, almost every other village can connect with a person they know, they work with, a villager, somebody you go to church with, your brother, your sister, who has been affected. And therefore, probably this offers a greater opportunity for us to marshal public efforts and all energies towards fighting this COVID-19. The only missing part in this second wave is that in the first instance, there was a lot of coordinated effort between national government, county government, media, everybody you can imagine. But in the second wave, we have seen a bit of slackening on the same. And therefore, for Nakuru, if I may speak, today we had a whole day meeting to try and bring these teams together, because the good thing about implementing any project in Kenya, there is no village where you don't have a chief, a police station, a county administration office, and therefore if we have a program that we want to enlist, including enforcing of the mask, which has proved to be also the magic in this whole conversation, it can be done. So the issue is, can we reinvigorate our teams and get down to action? And public behavior becomes a major impediment in this whole fight on COVID-19.
Okay, I do want to talk to you a bit further about whether counties feel that they've been left on their own. But let me bring in Dr. James Nikal, a member of Parliament, Seme, and also former Director of Medical Services. Daktari, it's been about, 8-9 months now since the first COVID-19 case was reported in this country. If you are to take a look at our response, whether in regards to the first wave, and I say that because some say we are still in the first wave, and in response to what we are seeing right now, how would you say Kenya has so far reacted to COVID-19, Daktari, in a few words?
Was concerted effort, there was a lot of coordination, there was strict monitoring of the guidelines that were put in place. And because of that, we actually saw a good response. And we reached a point towards what we were thinking was the end of the first wave, when the figures went down to about 3% for a consecutive number of weeks, and then we relaxed. After that, that relaxation, we didn't actually open up, but the guidelines that were put in place were actually not followed. People went flat out. We were to say the churches 200, funerals 200, restaurants, the number of people, the hand washing at the entrance, and so on. So those people didn't follow. And so now this second wave, actually people have relaxed, and even right now, the guidelines that were put in place, people are not following. You go to in many places, not all are wearing masks. The social distancing in churches is not just there. In funerals, it is not just there. So I'm not satisfied with the second response. The first response, also the coordination between the national and the county government, in my view, was much better. When you traveled, you actually noticed that you reached another county, the actions they were taking.
Okay.
How we used the money, again, I'm not very satisfied. When we visited the counties, sometimes the money went late. The coordination between even the supply from KEMSA to the counties was not very good. You find that some counties were using things that they bought themselves that didn't come from KEMSA. The procurement from KEMSA is another big story we don't want to get into. We can't get into now, but again, that was a problem. So first response was good.
Okay.
This second response, I'm concerned.
Let me ask you this, Dr. Nikal.
It may take us a bit of time.
Let me ask you this, if you can hear me. How would you rate the response?
Yes, I can hear you.
Yes, how would you rate the response of the ministry in terms of educating the public on what needed to be done? Do you think it's been adequate? Do you think it has changed with the changing nature of the pandemic? How would you rate the education strategy or the communication strategy of the ministry?
The communication strategy of the ministry, I think, has gone down from the first response to this response. It is not in the media as much as it was last time. Even their link with the other government structures, like even with the chiefs, even with the assistant chiefs, I don't feel it the way I was feeling it before. So I think we've kind of relaxed a bit. The first response was better.
The first response was better in your view. I want to take you back, Daktari, to the year 2001. African Union countries then met and pledged to set a target of allocating 15% of their national budget to improve the health sector. It is said that if African countries had adhered to that deal or agreement that they signed, that it may have been easier to handle COVID-19, bearing in mind, I think Kenya has only achieved between 7 to 9% to about 9 to 7% of total budget in the last 5 financial years or so. Talk to us about what it means on the ground when less than 10% of your budget goes to health, and how COVID-19 exposed that, these gaps, these deficiencies.
Talking about Kenya and many African countries, that agreement actually was not adhered to. We didn't go up even to 10%. I think the highest I can remember is probably around 2005, when we went to nearly 8, almost to 9%. But because of that, the infrastructure has not developed as it should have been. And to the human resource, although it has developed, there are numbers, but the employment of human resource, which is very important in a country like Kenya, in the public service, has not been adequate, and even the management of that. But the biggest thing is lack of adequate funding. Now we are at probably at national government still gets about 6% of the budget, which maybe should be less. Some should go to the counties. The counties are putting about 30% of what they get. So if you do all that together, I think you're probably around 7 or so percent. It has cumulatively retarded our development. Had we done this before,
yes,
we would have had structures, we would have had adequate human resource in public facilities. Private facilities offer very little services, and they are not the mainstay. It is the public facilities that we need to look at. So the investment has not been adequate.
Tell me this.
Even look at NHIF.
Yes, and
again,
I want to interrupt you.
By 2005,
yes,
we were thinking of putting it to a national social health insurance. We didn't get to that, and therefore we are still in a situation today where we are wondering whether NHIF should pay for COVID. Had we gone social health insurance, that is something we would have been doing by now. We would have probably have achieved universal health coverage.
Dr. Nikal, and I want the governor to come in on this. I'll give him a chance to do so shortly. Take us back to when you were the Director of Medical Services at the Ministry of Health. And at that time in Parliament, some of our very high-ranking leaders were at that point members of Parliament and so forth, members of, chairs of committees, etc. Did you feel that, Parliament and the leaders then provided you with the support that you needed? Do you feel that health financing is taken as a matter of priority in this country? Because that could explain why we find ourselves in the situation we find ourselves in tonight. What were your thoughts then on the priority that health was given, Daktari?
Around 2005 to 2007, there was a better priority, and that is when we were trying to bring in a national social health insurance, and maybe I'll say because there was so much money needed for it, and it wasn't the bill wasn't passed. In some way, we were given more money. I remember we were actually got 1 billion shillings that time. That was a lot of money to actually just improve the infrastructure. But two things happened. When we went into the coalition government, the ministry was split. The Ministry of Public Health and Sanitation did a little better, to a large extent because of partner support and looking at issues like vaccine, issues like primary health care. The medical services, like hard clinical services, didn't get as adequately funded. So that then brought the structure down and even the coordination. It recovered, and then when we got to 2012, when we now had the devolution, again the structure was actually in a way disrupted. And I must say, up to now, the coordination of the devolved health system between the national and the county government, it is improving now, but it has not been good. You see what the human resource problem we are having, basically as a result of that coordination.
Okay.
So we have not put as much focus on health as we should have, both in financing and even in the management.
Okay, you've raised some interesting points that I'd like Governor Kenyan to respond to, the coordination between national and county governments. Governor, bearing in mind, and a question coming in from a viewer here, I hope it hasn't. Yes, Sir Nixon Dugire, kutoka Kindaruma, loyal viewer to the program. Thank you so much, Sir Nixon. Says, Governor Kenyan, there's a looming nationwide doctors' strike. How do you think this can be averted, starting in Nakuru County?
Thank you. I think I want to confirm that indeed the coordination in this pandemic war is very critical, because as we have seen, there are people who will only wear a mask because a policeman is there. There are people who will not comply unless the government or authority is there. And that being the nature of Kenyans, we cannot change them at this stage. So we just need to ensure that there's enough enforcement. All teams are working together. All multi-sectoral teams are working together. We had a very good program initially where even when it came to contact tracing, even our national intelligence system was looped in. So that if we found one person who had turned positive, we would be able to get all the others. So the looping in of all these sectors will help us to ensure that we go back to where we were, and I think also more importantly, put the public in the forefront on this. When it comes to the doctors, I think we must first start by saying that indeed at this time, we must appreciate our health workers. Because indeed, unlike all the other careers, when you say work at home, almost everybody else can work at home, but a doctor cannot work at home given the circumstances and the nature of their work. A nurse cannot also work at home. So we tell the other people, work at home, work online, but this doctor has to be there, has to examine this patient, and even if they are not in the forefront per se, the exposure is very high. So they have some issues, in my view, that I think we need to look at. I think the first one is the insurance. That is a matter that every doctor and every nurse who goes to work must know that in the event they fall sick, their back is covered. And I think they have also requested that some wards or certain section of the hospitals are also set aside for them, because their risk is obviously much higher than all of us because of exposure. Those are reasonable requests. And I think at this time what we need to do is through the national government, through the minister, to start engaging and working with them. We also realize that there's a serious burnout. These are people who wake up every day into this COVID situation. They've been there for 8 months, and we've realized that beyond just giving them the PPEs, there's also a human, emotional side that we also need to deal with. And I think through counseling and all these other ways, psychosocial support programs that we can put, we can be able to work with them. So I think right now it's important that we deal with our labor issues. I think it's not just about money. There are issues that we probably need to look at. We need to be better coordinated. And I think when you also have an open communication channel where they have issues that need to be addressed, we can work with that.
You're speaking in a manner in which, I mean, it sounds like if you implemented all those things, the doctors wouldn't go on strike. Is this something you're engaging the doctors at your county on? I know, the tussle between national and county governments over health is still there, but do you think the strike could be averted? How positive are you in regards to that?
Yeah, definitely it can be averted. The truth is these doctors also live in this society. And if we closed all our hospitals, even they themselves, when they fall sick, they would have nowhere to go. So the truth is we are all in it together. And I think the most important part is to ensure that the issues they raise, those that we can deal with, we are able to deal with. Those that we can't, because some of them may have serious budget implication, we can be able to see how to work on it. There are instances where probably in a CB agreement, this was agreed but was not implemented. Those are some of the issues that they are raising, and in our view, much of them can be done. Are we engaging them at our level as a county? I think that's a reality. We are the employer of all the medical staff in our public hospitals in Nakuru, and therefore our responsibility, even before you talk about national issues, is to deal with them at that level. And I would say, in our opinion, a lot of those that are supposed to be done by the counties, we undertake to do those that are within our power. The others that are national, of course, our colleagues at the national government will work with them. But it is very important at this time, given that nobody knows how long this disease will be here, given nobody knows the trends that are likely to come in the next so long, it is important that we also work together with our health workers and that they are not on one side and we are on the other side.
Okay. Governor, tell me this. Tonight, and I know you may not have the numbers offhand, but you might have a rough idea. How full are the beds in Nakuru County? And as we draw nearer and nearer to the festive season, Nakuru County, very strategically positioned, the place you pass through before you go to different other parts of the country as well. How are you preparing for this? Are you looking to scale up ICU beds, oxygen facilities? But first, begin by telling us, what's the state of your hospitals tonight?
Okay, we would say largely we are at about 75% occupied. But the bigger conversation now is on home-based care. We have trained thousands of people because most of those who turn asymptomatic do not require to go to hospital. However, those who require to go to hospital, we must ensure that there is capacity. And as I said, we continue to add oxygen to hospitals that didn't have and those that currently have, to also ensure that our workforce is working together. Our bigger problem is that in urban areas where mainly we have seen this disease, the average age in urban areas tends to be a bit low. When you go to our rural areas, that's where we all retreat when we get old, when we get sickly, and so on and so forth. Therefore, as we approach this Christmas and the festive seasons around December, the concern around how we are going to deal with the people going back to see their grandparents, people meeting relatives after a long time, remains a critical issue. Old people have been found to be highly vulnerable, when especially they have other conditions, including hypertension and diabetes. It even gets worse. So that cocktail of families meeting after a whole year of lockdown, not met in a long time, is likely to have serious implications come January, maybe 2-3 weeks thereafter. So I think we need to approach the season with great caution. Other countries across the world have gone back to lockdown. It may not necessarily be the best thing, but we also realize that festive seasons are associated with merrymaking, drinking and partying and all those activities that are bound to make the pandemic even get worse. Okay. So we are relatively worried about that season, but I think the most important part is also to ask for personal responsibility as we engage on this conversation.
Let me bring Dr. Nikal into this, and Dr. you can also respond to what the governor had to say, even as you tell us this. How much of the national budget should be allocated to healthcare, in your view, in 2020, 2021? And what do we need to do for things to work? For example, what would you say are short-term measures that can we quickly put in place to support counties at a time like this? We are hoping that, we are over the worst of it. We're hoping that this spike we are seeing will go down over the coming days. But for discussion's sake, if it doesn't, what should the Ministry of Health be thinking about at a time like this? Dr. Nikal.
I think the first thing that the governors and the Ministry of Health together should do is to resolve the issue of the health workers and the strikes. The governor actually mentioned most of the issues, but another one that came in that didn't come in is the protection that they need. The PPEs are critical for the health workers, and also the availability of care for them when they are sick. And there were some allowances that were being given to frontline workers in the health sector, which are a little more than just the nurses and the doctors. The other people, those should be put in place. In terms of infrastructure, I think the agreement, the money that was given, that the governors should use to improve the facilities, in some cases there was delay, the money came late. I think where the monies were not given, they should be given, and there should be a clear coordination so that the national government knows exactly which county government needs support and in what area and what money can they be given. Even the allowances that were given to health workers actually was calculated on a 3-month basis, which I think has ended, and I'm not clear that that has been worked out. And it is these things that you start and then you don't continue that eventually bring the human resource issues. Another thing even about the the allowances that were given frontline workers. I do not know who decided who is a frontline health worker, because obviously the nurses, the doctors, but all the people that are working in hospital, including the sweepers. So that was another area where I think they needed more support than they received. The issue of KEMSA is also critical to the county governments. If the supply from KEMSA is not regular and in time, then I do not see how the counties will deliver the services as required. But the other thing that I think both the county and the national government should agree, the national government holds the mandate of standards and policy. The county government is actually the institutions that deliver the services. But there should be a way that actually one can call out that in this county, you have to do this, to do this, to do this. Look at the issue of facilities, the levels, level 2, level 3, level 4, particularly level 4s now, because that is where I think most of the very ill people will go, need to have oxygen, virtually all of them. And the national government should actually make it very clear what is a level 4, what are the facilities that needs to be there, what are the staff that need to be there. Even if the governors are doing it, I don't know whether they have very clearly, if you call this facility level 4 or level 3, we expect 1, 2, 3, 4, 5. And I'll tell you, if we had those structures, the health workers, the doctors and the nurses, actually their biggest motivation is getting facilities and equipment to work with easily. Even the salaries may be important, but again, what brings the issue of the salaries is agreements, the collective bargaining agreements that people go into, and then they don't deliver. So I think we need to support the national, the county government.
Tell me this.
Look at what their needs, meet those needs.
Okay.
At this point in time, I think the national government, as I said, should be much awake and be in contact with all county governments and say, this county needs this and this and this. Let's see how we can provide it. Do they have the money? If they don't have the money, if it's in the budget, do they get it and get it in time?
Okay.
That is needed.
Let me ask you this, Dr. Nikal.
In this COVID situation.
The
amount of money, I think this country should move very fast towards 12 to 14, even if they don't reach 15%. And I think I'm in the health committee, and I know we still have a lot of money that actually is disbursed through the national government, like when you want to buy equipment. You can help the county governments by sourcing where the equipment are, but it would probably be better if the money is in their hands and they know where to buy than try to buy from here and give to them.
Okay, thank you for that.
Those are some of the things.
And you're right. That was one of the questions I was going to remind you about, and you've tackled that. Governor, even as we wrap up this conversation, the education sector still trying to understand this pandemic. As you know, a school calendar rollout plan started about a month or so ago. Further, we'll see more students going back to school in January as well. What's the status of the schools in Nakuru County, Governor, and what are some of the concerns there as well? I'm sure you chair meetings where COVID-19 and its impact on the education sector in your county is a major talking point.
Thank you. I think we are all concerned because our children have been home since around March, and as a result of that, the anxiety to ensure that they go back is quite realistic. However, the protocols of back to school remain a critical thing. We still have in public schools where one classroom that should otherwise be having 30 students has 90 or even 100. I have a school in Naivasha, Mirera Primary, where you have about 4,000 children in one school. So I think the issue of undercapacity, having few classes and therefore too many students in one classroom will be an issue, and therefore achieving the necessary social distancing protocols will be a matter that will probably require real financing and also ensuring that the financing is there on time. Is there water in all our schools to ensure that our kids wash their hands every now and then? That may not be correct. So we also need to invest heavily in the area of providing water so that children can be able to wash. We will try and work on how we can provide masks, and maybe the bigger issue here would not just be how we can get masks from somewhere and present them to the schools. But I think also using the schools and the communities, we need also to look for ways in which you can improvise, using whether it's a cloth at home and all that, because if we say we want to provide every child with 1, 2, 3, 4 masks, that will not happen between now and January. So which other ways can we be able to do? They may not be 100% perfect, but they will help us to get back there. And I think also more importantly, children also have to be adequately taught on how they can also prevent. Children are the best when it comes to enforcing, and they can also help us to enforce it even to the parents and the society at large. I would quickly want to mention on the issue of insurance, because it is also very important. We'll also need to look at when children go back and they fall sick, where does the liability go? There are some insurance issues we need to look at. And now with NHIF saying that they had not factored this, I think it is expected that the numbers we took had not factored a pandemic situation. But can we rework other numbers so that now we say, because of this is the number that we have to pay, so that we can cover our workers, and also schools maybe would require some sort of insurance program so that we can ensure that kids don't just go back to that. Lastly, Maura, I would want to mention quickly on the issue of the vaccine. The hope for much of the world is on a vaccine being discovered. But being discovered is one thing, getting to poor countries in Africa and all here will be another issue. So I think also we would really want to urge that Kenya becomes very proactive on the issue of vaccines, and also to confirm that sometimes when there are vaccine trials across the world, a lot of us, when here there's a vaccine trial, even here in Kenya, we don't want to be part of that research. You don't want any trial. But if you do not participate actively in the search for a solution to a problem as big as this, then who are those other human beings in the rest of the world who are ready to offer themselves? So I think we want to be active both in the trials and in the final distribution of the vaccination, because the reality is that the disease does not appear like it will go anywhere, yet we need to go on with our lives, our economic activities must go on, and our education must also go on. Thank you.
Okay, you've actually introduced an interesting component that I want Dr. Nikal to give us a final word. Daktari, you sit in the health committee. I'm sure you've had lots of meetings this year to discuss COVID-19. Have any of those meetings been around the search for a vaccine, how Kenya can best prepare to ensure that we are a front runner when a viable vaccine is finally available? Is that a discussion that's been had, Daktari, in the health committee? And also, what are your personal views? How can Kenya ensure that it really is ready and sort of ahead of the line or ahead of the queue when a vaccine becomes available either late next month or into 2021?
Yes, we have discussed the issue of vaccines, and the first thing we have said, Kenya needs to actually participate, and we were concerned that KEMRI is not adequately financed, and we try to give some finance so that they even can take part in some of the trials. I know they have some vaccine that is on trial by them, but they can even work with other countries. I know they may have a link with Britain on this, but just being part of the trial system brings you closer. Number two, there are two vaccines that have come now. One is the Pfizer one, and the other one is the Moderna one from the US. The Pfizer one, the temperature requirement is so low that it will be very, very difficult to distribute and manage. The Moderna one, if it comes, and it's as effective as, say, about 95%, it requires just a good household fridge will go up to -20. The other one is going to -70, which is 3 times. So it may be an easier vaccine to handle. And what I would advise, one, at national government, we now start getting involved in following this process and looking at the procurement even in advance, because sometimes vaccines are purchased even before they are produced, once they are agreed that it is working. And I think countries will line up basically on first come, first served basis. I think at national government, That should be important. At county government, there should be need to start preparing, if a vaccine were to come, what are the structures that we need to deliver this vaccine? Are we going to use the current vaccination system for children? Because now we'll probably be dealing with adults. And what structures will need to be in place? Where are we going to have the cold storage, the vaccines, the cold carriers, the cold boxes, and the staff that are going to do it? If we wait until now we buy the vaccine and we start doing that, we won't do very well. So there's need for preparation at research level. That's KEMRI, we should get involved. But now that the vaccines seem to be there, look at the one that is best suited, start preparing the purchase and get into line. And 3, start preparing our infrastructure up to the ground on how we'll deliver. The other issue that will come is who is going to get the vaccines first, because vaccines are given to the most vulnerable people. Probably we'll start with older people, people with underlying conditions. But let me say something about schools that I don't hear people talking about.
Okay.
We talk about children, and that is important. We protect our children. But remember that when children go to school, they interact with the teachers. Children are super spreaders. They not get as sick. I don't hear much protection being directed towards the teacher, particularly elderly teachers and teachers with underlying conditions.
Okay.
And another thing to think about, particularly when you are dealing with the day schools, is that the parents they go back to, older parents, may actually be exposed. The children may have the virus, but they're pretty well. But when they go home, then the grandparents and the parents. So that's another area when we open schools we need to look at.
Okay. Dr. Nikal, in 30 seconds, because our time really is up, if a vaccine is announced as ready for distribution end of December, because you understand the procurement process, you understand how things work, from a Ministry of Health perspective, you sat in that seat. How long do you think it will take before it gets to our shores and it gets to help people? How long do you think that will take? What's your estimation?
Well, I can't really get that, because that is looked at the production at the international level. But I think WHO will be involved, and depending on the demand that it is and the production capacity, I really think the country shouldn't go beyond 2-3 months. But I'm putting a wild guess, because there are many factors that are in place. But if we start preparing early and even making fund, because sometimes they may require us to actually put some money aside.
Yes.
There are times that the producers of vaccines actually may be funded even before the vaccines come.
Okay.
And the organizations like Global Alliance for Vaccines, those are areas that I think we should start looking at.
Thank you. Thank you, Dr. I'm sure there are many tonight just really praying and hoping that those vaccines can indeed begin to get in within the next 2 to 3 months. Let's take a look at some of your feedback. This is what Kenyans...
But let me say something, Waigwa.
Very brief, please. Our time is up. Briefly.
The most important thing is each person must decide to protect themselves and follow the guidelines. And I think the government should actually monitor more. I'm not happy, as I said, with the monitoring of the guidelines now. The key is getting people not sick before the vaccines come. Okay.
The key is getting people to not get sick before the vaccines come. I think you've sent that a very clear message, Dr. Nikal. Okay, this is what you're saying. Let's start with Twitter. Danson Kuruna says, there seems to be a lot of similarities between how we are treating coronavirus and how we conduct our politics. It is like we are suicidal. Okay, very strong message there. Another tweet. Zablon Orina 1. Kenya dedicates less than 10% of its budget on healthcare. That's why everyone's dream is to be able to afford the services of a private hospital. Government hospitals should be improved to international standards. Every life should matter to fellow Kenyans. Okay, let's take a look at another tweet. Remember, hashtag is Newsnight. It's Kipleting says we should all adhere to Ministry of Health Kenya guidelines without failure. Only God, self-discipline, and individual responsibility will save our country from COVID-19 infection. All right, and let's look at another one. Cove Park official, the government must engage citizens in a manner that doesn't discriminate or doesn't incriminate COVID-19 prevention and care. Kenyans like opposing the government. Kenyans might be avoiding Ministry of Health guideline to punish government while people are hurting obliviously. Okay, and one last one. Kavin Sam says, I agree with James Nikal. When we talk of frontline workers, we have totally forgotten sweepers and cleaners in these hospitals and healthcare institutions. They too deserve COVID-19 packs. All right, and even as we wrap this up, one SMS, this one is going to the governor on an off-topic. Governor, somebody asking about the saga of the street children. I don't know if you have a response for them. We've gotten quite a few messages of such a nature. The mystery of the street children that were dumped. Any response on that, Governor?
Okay, maybe this may not be the best forum, but the thing to say is that we as a county take those allegations very seriously, and we have also instituted investigations to confirm the seriousness, if it were, and also to request that sometimes when issues are too politicized, you lose the real sense. All big cities and towns across Kenya have a problem of street children, and I think that matter needs to be dealt with in a serious manner. For Nakuru, we are not just looking at the problem now, but also problem in future, and I think the problem is when a matter is hijacked and politicized, sometimes you lose the real sense of the matter.
Is that what's happened now?
Yes, that's the situation.
Okay.
But we will be dealing with this issue, and I think we welcome any people because, like I said, we as a country have not been able to crack the issue of the street children problem because as a society, we shouldn't even be having street children. Where do they come from? But even when they come, how do we deal with this situation? Thank you.
Thank you, Governor. That's a question that had come in at the tail end via SMS line 22422. And that's how we wrap up this discussion. Thank you so much. We've had in studio Governor Lee Kinyanjui, Governor Nakuru County. Thank you for your time and for sharing with us the COVID-19 challenge in the counties. And joining us remotely has been Dr. James Nikal, Member of Parliament for Seme, a former Director of Medical Services at the Ministry of Health. And he says, don't wait to get sick. What measures can we put in place to ensure that as few people as possible get sick in the first place? That's what we should be thinking about at this time. To my guests, thank you, and to everyone who's contributed to this program in one way or the other, either via SMS 22422 or hashtag Newsnight, or even taking time just to watch. We appreciate. Remember, we do this every Tuesday, and we'll be back here again next week, same time, same place. On behalf of the whole team that's made this broadcast possible, and the technical team as well, thank you so much. And my sign language interpreter today has been Wilson Mushora. Nevertheless, I need not repeat this again. Stay safe. Wear a mask as much as you can. Let's try and social distance. We're still not out of the woods just yet. And we need to take care of ourselves and take care of our family members and those around us as well. We'll see you soon. Have a good night. My name is Wahiga Mwaura.